So at Totalcare Hearing, we really like to get an overall picture of our clients when they come in. So when they first come into the appointment, we'll get them to fill out a case history form, letting us know any relevant case history, medical history, and any frustrations they're having in listening difficulties and things like that. The audiologist will then review the paperwork and then call the client in to the appointment, where we have a pretty in-depth case discussion, because I find this is very important to get a good idea of the client's lifestyle, get a good idea of where they're having frustrations hearing. We go through medical case history again, and it gives us just an overall picture of what's happening in the client's life. We then go through the testing. So the audiologist will look into the ears using a thing called otoscope, and that's just basically putting a little light in the ear. We're checking for the ear canal, making sure there's no debris or wax or anything like that, and making sure that the middle ear, the eardrum's healthy and there's no middle ear infections. We'll then do a test called tympanometry. Now what this involves is putting a little probe, a soft little probe in the ear. It doesn't hurt, it's not invasive, but basically what we're doing is we're trying to measure how the eardrum's moving and make sure it's moving well. And all we do is put the probe in the ear, and there's a slight little pressure that moves the eardrum. It kind of feels like, going up in a plane and down in a plane, that type of sensation. And that gives us a good idea how everything's going. Now we get you in a soundproof room. We do a test called audiometry. Now this is the gold standard test for audiology. We get you to sit in a soundproof room with a button, and we put headphones on. And all you need to do is, whenever you hear a little tone of different pitches and frequencies, you just need to press the button to let us know you've heard it. This takes maximum 5 or 10 minutes. We do this for 2 different headsets. And then we go on to speech testing in that same soundproof room. So speech testing just involves repeating back words at different levels. You're going to repeat it back to us, and we're just trying to find out how you're hearing speech. And this gives us a good idea of whether hearing aids will be beneficial or not. Depending on the results, we then might go on to a speech in noise test. And what this involves is just repeating back these words in background noise. So basically you have a babble of speech and noise, and you're repeating back the list of words as well.